Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. I am Rawia Al Qadir, Head of Mass Segment and Smart Banking in Abu Dhabi Islamic Bank, and welcome to the Breast Cancer Awareness webinar. I will be your host for today. Before we start our session, there are a few points to ensure that you have a smooth experience through our webinar. First, please ensure to close any inactive programs, applications, or web pages to avoid any issue with your internet. There will be a draw on 500 Amazon voucher at the end of the session for all the participants. So please stay tuned to the end. For the Q&A, you can post your question on the chat box, and we will be answering your question at the end of the presentation. So, before I start the webinar, there are a few questions I would like to ask. You will be able to answer them by clicking, is it true or is it a myth? Our control room, can we have the question, please? So, the first question is, mammograms do not cause breast cancer. Is this a myth or a fact? Mammogram do not cause breast cancer. Myth or a fact? I can see a lot saying it's a fact. So what will be the right answer? Is it a myth or a fact? Polling still going on? Just to be clear, does mammogram cause breast cancer? So mammogram do not cause breast cancer. Is it a myth or a fact? The numbers are too close. That's very interesting. So we have people thinking it's a myth, a lot thinks it's a fact. The answer of those questions will be while our doctor is giving us the presentation. So let's see. A lot say it's a myth. Mammogram do not cause breast cancer. So do you think mammogram, if we do mammogram, it's not going to cause any breast cancer? Interesting. Can we go to the next question? Finding a lump in your breast means you have breast cancer. So if we find a lump, it means it's definitely a breast cancer. Is this a myth or a fact? Finding a lump in your breast means you have breast cancer. A myth or a fact? A lot have said it's a myth. Okay, we move on to the next question and the final one. Breast cancer only occurs in women who have family history. Breast cancer only occurs in women who have family history. Is this a myth or a fact? I can see a lot have been saying it's a myth. So breast cancer only occurs in women who have family history. Interesting answers. So that is the end of our poll. breast cancer is one of the most common cancers spread in the UAE. A study shows that 1 from every 4 women who've been diagnosed with cancers have a breast cancer. These numbers are considered high, but again, we have to remember that there are survivors. Survivors who have decided to take control of their life and look after their health. And that only happened with early detection. So they've checked. Today, we have Dr. Caroline from MediClinic who will explain to us or give us more information about breast cancer, the reason, and the different method that we can detect those breast cancer. Dr. Caroline, the floor is yours.
Thank you very much. Good morning, everybody. It's my pleasure to be here today to talk to you about breast cancer awareness. Could I have my first slide, please? Thank you very much. And the next one. So I've listed here today what I'm going to be talking about. So initially what I'm going to do is start talking about why we have breasts and what they are actually used for. I will very briefly explain what breast cancer is, and I will discuss facts about breast cancer, both in the UAE and across the world. I will share knowledge on breast awareness, particularly how to examine yourself at home, when you should go for screening, and what to do about family history. I'll also talk about some risk factors which are well recognised with regard to breast cancer, but also importantly, some preventative facts, so things that we can all do which will help reduce our risk of developing breast cancer now and in the future. Please, can I have my next slide? So similar to what you've just been asked, I have a few questions here as well. This again is a true-false or a myth or a fact. So if it's a fact, it's true, and if it's a myth, it's false. So the first fact or myth is that women should have breast screening with mammograms of both breasts every 5 years. Is that a myth or a fact? Number 2, breast self-examination is easy to perform at home. Is that a myth or a fact? Number 3, breast pain is not a symptom of breast cancer. Number 4, most women diagnosed with breast cancer have a family history. And you've already answered that, and many of you think that that's a myth, and I'll explain that in more detail during my talk. Number 5, men cannot get breast cancer. Next slide, please. So first, what I'd like to do is just talk a little bit about the breast and try and understand the anatomy and the physiology of it. So we know that the breast is an important part of the female anatomy in particular, because it's where the milk is produced for us to be able to feed our children, feed our babies. And it's a source of food that we can carry around with us and protect our young and feed whenever we need to. So in this diagram here, you can see the muscle towards the left, that's the muscle of the chest wall. And then the pink and yellow tissue towards the right is what we call the breast tissue. The pink areas are called the lobules, and that is the milk-producing tissue. You may hear a doctor refer to it as the glandular tissue, and it's really what makes our breasts feel quite bumpy when we examine ourselves. The milk, once it's produced, travels down little tubes or ducts and is released from the breast at the nipple area. The yellow tissue, or the fatty tissue, or the adipose tissue, is really there just to fill out the rest of the breast. And we all have adipose or fatty tissue in different proportions, which means that actually there are many, many different shapes and sizes of breasts. And I think the one thing I would really like to emphasize today is that we are all different. So many, many women I see have one breast that is slightly bigger than the other. Perhaps the nipple points in a slightly different direction. Maybe it's a little bit more lateral on one side, or it points a little bit more upwards. Many of these are changes that we've had since puberty, since we started changing to become a woman. And they are very normal, and they're nothing to worry about. If, however, you notice a new change, then that is important to get that checked out. And I'll talk about that in more detail later in my talk. Next slide, please. So the breasts are intricately linked with our periods, with our menstrual cycle. And that's because the breasts are responding to whether or not our body might be pregnant. So when the body starts the period or the menses on day 1 of the cycle, the body understands that the breast and the milk is not required. And therefore, at that point in time, the breasts are at their softest and they're empty of any milk. So you can see from the pink arrow at the bottom of the slide, this is actually the optimum time for you to perform breast self-examination at home. I tend to advise not to do it further down the cycle, so particularly in the second 2 weeks of your cycle, because as you can see from the pink lines here, the female hormones, the estrogen and the progesterone, are much higher. And what they do is they cause the breast tissue to become more swollen and fuller as the body prepares potentially for pregnancy at that time. Next slide, please. So what is breast cancer? Breast cancer, by definition, is a disease in which cells in the breast grow out of control. Breast tissue, as I've just mentioned, is tissue that's actually rapidly changing. And that's another thing that I often talk to women about in my clinic. I think we're often led to believe that our breasts develop at puberty and they stay the same throughout our life, only changing during pregnancy and breastfeeding. And that's not the case. They change throughout our life, just like other parts of our body, like our skin and our hair. So it's understandable that we need to keep an eye on them and keep a check on them. In terms of the cells that you can see on the screen here, normal tissue is on the left and cancer cells are on the right. And apologies, my formatting has just gone slightly off, but the reason I've put this on is that if any of you are to have a tissue sample taken that shows some atypical cells, this does not mean that you will develop breast cancer in the future. It's still important to be aware and have surveillance, but it does not mean you will automatically develop cancer in the future. So please try not to be alarmed if that happens to you. Next slide, please. So I'd like to talk about some facts related to breast cancer, and every country produces facts around their own population, and the World Health Organization attempts to collate these facts to provide an idea of what's happening across the world. I'd like to start by talking a little bit about the United Kingdom. I've then got some facts from North America, and then I will come back to talk specifically about the population within the UAE. So in the UK, of all newly diagnosed cancers, 15 out of 100 are breast cancer. So that's in men and women. That's quite a high proportion given all the different types of cancer that we see. However, a positive thing that has happened in the last 30 to 40 years, particularly in the UK, is that survival is improving. And now many women will survive 5 years and actually even longer. So it's important, again, if you are diagnosed with breast cancer, many women are treated successfully. It is age dependent, and I will talk a little bit in a moment about who gets breast cancer. But we also have to understand that within that statistic of 85 out of 100 women, some of those 15 women actually have died from other things, because unfortunately, age is a risk factor for us all. I think another statistic that's interesting and is applicable across the world is that many breast cancer cases are actually preventable, and that's been estimated as many as a quarter. So nearly 25 or 1 in 4 women who have cancer, potentially it's preventable. And I'll talk about those preventable causes later in the talk. Next slide, please. So 1 in 8 women across the world will develop breast cancer in their lifetime. And interestingly, in the time that it took for me to write this talk a few weeks ago, I've now actually seen statistics stating it's 1 in 7 women who will develop breast cancer in their lifetime. But interestingly, it's often thought that breast cancer is a disease of younger women. And whilst younger women are affected, actually the vast number of cases are in older women. So 80% of cases are in women over 50, and 93% of cases are in women over 40. And you can see this graph here, which is Canadian statistics, demonstrating that really, as you get into your 50s and 60s, your risk significantly increases, and then it levels off sort of in the 60s, 70s, and 80s. Next slide, please. So what about here in the UAE? So as we've already heard, breast cancer accounts for 1 in 4, 1 in 5 cancer cases in women. So that means for every 100 women who have cancer, 20 to 25 of them will be breast cancer. And again, that's an astonishing high rate given the number of different cancers that we see in women. And unfortunately in the UAE, the mortality rate, the risk of dying from breast cancer is actually still quite high. We don't really understand why that's the case. The data within the UAE is relatively new. It's a young country. The Department of Health is very keen to gather cancer statistics, and there is now a cancer registry where we are able to gather information and data so that we can understand better what's happening in this country. But it is known that deaths from all types of cancer in the UAE is actually the second commonest cause of death behind cardiovascular or heart disease. What is interesting about breast cancer in the UAE is that it does tend to present at an earlier age, and it's been suggested that it presents up to 10 years earlier than in other countries. So if most cases are between the age of 50 and 60, for example, in the UK, then actually we would be seeing them between the age of 40 and 50 here. We're not really sure why that is. Is it something to do with the cancer itself? Is it to do with the age of the population? Most of the data that we have does relate to the Emirati population. It is quite difficult to gather statistics on the expatriate population as it's such a transient population. But we do know from the data we have that there is a higher incidence of something called HER2 positive breast cancer. The HER2 marker is a growth marker, excuse me, which is present on the breast cancer cell, and it triggers the cancer cell to grow. So it is a bit more aggressive. However, it's also been an area of a huge amount of research, and we now have a targeted treatment that we can specifically give to women who have HER2 positive breast cancer with often extremely good outcomes. It's also been noted that there is a higher incidence of genetic mutation accounting for breast cancer. So in most women who have breast cancer, there is no genetic links, there is no recognized family history. So if I see 100 women with breast cancer, about 90 of them will not have any significant family history. Next slide, please. So what about men? Men can get breast cancer too. It is much less common than in women. So compared to the 1 in 7 or 1 in 8 that I've just quoted for women, it's about 1 in 1,000 men will be diagnosed with breast cancer in their lifetime. And the most common presentation for a man is that it presents with a lump directly behind the nipple. I often see men who have a small lump on the chest wall, slightly away from the nipple area. This is more likely to be a cyst or a normal, benign, harmless fatty lump, but I still encourage people to get it checked. It's still really important. In terms of how can men get breast cancer? Because they don't have breasts like women do. But interestingly, all of us have a small disc of breast tissue behind the nipple when we are younger. And it's girls who have the female hormone, particularly estrogen, which causes the proliferation or the growth of the breast tissue to create the breast shape that we know today. For men, they have the majority of testosterone, the male hormone, but they do have a small amount of estrogen in their body as well. And if that estrogen increases for any reason later in life, it could be due to other treatments or some hormonal imbalance, then they are actually at an increased risk of developing breast tissue, which may contribute to their risk of breast cancer. Again, we don't know a huge amount about male breast cancer, but we're learning all the time, and there's a definite push to gather data on that. In terms of family history, if there is somebody in the family who has had breast cancer and is tested positive for a genetic mutation, particularly the BRCA1 and BRCA2 genes, which are associated with breast cancer, then male relatives are offered that test because it can be passed down through the male side of the family, the genetic mutation. In terms of what we of how we manage men with breast cancer, the diagnosis is exactly the same. So they would have a clinical examination, imaging including mammograms, a tissue sample would be taken, and then we would base treatment on the findings of that tissue biopsy, exactly the same as we would for women. Next slide, please. So there's lots of information out on the internet, particularly at this time of year. I arrived in the UAE about 12 months ago, and I was delighted to see all of the efforts that had gone into Breast Cancer Awareness Month, even with all the COVID restrictions that were in place. And I'm so pleased to see that that's been replicated again this year. Next slide, please. And sometimes there's some really interesting facts out there. So I quite like this leaflet on the right, because if you see where it says 5,000 years, what that's actually telling us is that breast cancer has been around for 5,000 years. And we know that because of an Egyptian papyrus that was found in a charity shop in England in the 19th century. And it very eloquently describes the symptoms of breast cancer. And there are many examples, particularly in artwork, where there are women who have been painted, and we can actually see the effects of breast cancer on their breasts. Next slide, please. So a lot of the information out there is about raising awareness, but it's also about informing women about treatment, about the facts, prevention and risk factors. Next slide, please. And there's also information about the importance of early detection. We know that if we pick breast cancer up earlier, then less treatment is required, and women do have a better outcome. And many women are worried and scared about having mammograms, but mammograms do not cause breast cancer. And whilst it may be a little uncomfortable due to the compression that is necessary, many women actually are quite relieved once they've had their mammogram and they get that reassurance that everything is okay. Next slide, please. So Pink October is something that's been around for 30 to 40 years now. And originally it was started to raise awareness and reduce the stigma of breast cancer through education about the symptoms and treatment. And for many cultures, it is very difficult to talk about cancer. It's a very scary word. And really what we want to do with these kind of sessions and talking to people and spreading the word is to really try and reduce that anxiety and allow women to take control of their health. So it was started in the 1980s as a collaboration between the American Cancer Society and a particular pharmaceutical company. And once they chose the pink ribbon, I think it's really gone from strength to strength. And I think they really are doing a great job to remove the stigma and raise awareness, and also talk about prevention. Next slide, please. So there are lots of different things that are going on. There's just a few selected items here about things that you can purchase to show your appreciation. There are many events that are organised, walks and runs, and lots and lots of things that will keep breast cancer at the forefront of our mind. And it's absolutely great to have this, and it's really important that we highlight something as devastating as breast cancer. But my message really is, this is not just about October. Please keep it going through November, December, every month of the year. Make sure that you do your checks, make sure that you talk to the women in your family, your friends, and let's all fight this together. Next slide, please. So what you probably are thinking is, well, how do I check my breast? What do I do? And whenever I see a woman in clinic, I always ask her, do you check your breasts? And I usually get the answer no. And when I ask why is that, just to try and understand and to try and help that patient, the two reasons I get are fear. I'm afraid of what I might find. I don't know what I'm looking for. And the other thing is, I don't know how to do it. Well, I will be able to explain to you how to do it. And with a little bit of practice, it's something that you can all do easily at home. So one of the most important things is to use the flat of your fingers and not your fingertips. And the reason for that is, if you remember back to the picture I showed about the anatomy of the breast, If you use your fingertips, you will feel the normal ridges between the pink lobular tissue, which produces the milk, and the yellow fatty tissue. And it will be very difficult for you to understand what's going on in your breast. So if you use the flat of your fingers, what you'll then find is that if there's a lump that shouldn't be there, then you will feel it. In terms of how to do the examination, it really doesn't matter which of the three methods you choose. You can go up and down, you can go round in a circle, or you can go in and out. What's really important is that you examine all of your breast. Next slide, please. So as I've already explained, the best time to do it is once a month after your period. Now, there may be some of you who don't have regular periods, or you've gone through the menopause, the change, and you no longer have periods. You can still do breast self-examination, and it's actually even more important, as I've said, as we get older, that we do it regularly. So what I recommend in that situation is to pick a day of the month, the first day, the last day, whatever day you choose, and just make sure you do your self-examination regularly. You can put a reminder in your phone, or you can download an app nowadays that will remind you when your self-examination is due. So the first thing we need to do is we need to ask you to actually have a look at your breasts and understand if there are some slight differences, if there's a little bit of asymmetry. One breast may be a little bit bigger than the other, it may sit a little bit lower. So look for any changes in color of the skin, changes in the shape or the size, or if there's any dimpling or scaling of the skin. And it's important to lift your arms up to see particularly if there's any changes in the skin. You can also then bring your hands down, put your hands on your hips and push your elbows forward towards the mirror. And this will help to contract or flex the chest wall muscles. And again, will just alert you if there appears to be anything in the breast that might need assessing. Particularly if you have large breasts, it's important to look at the side and also just to lift your breasts and look underneath and make sure there are no changes there. Next slide, please. So in terms of feeling your breast, this can be done lying down or standing up. Some women prefer to do it lying on their bed, others prefer to do it in the bath or the shower. And again, it really doesn't matter, whatever is most comfortable for you. And as I've already emphasized, use the flat surface of your fingers, not your fingertips. Start in one place and feel the whole of your breast. And that's particularly important if you have large breasts. You must make sure that you examine in a systematic way so that you cover all of the breast tissue. So particularly if you choose to do the clock face, where you're going around in a circle, you will need to do more than one circle and make sure that those circles overlap. If you have to do 3, 4, 5, it doesn't matter. Just make sure that you feel all of your breast. You also need to examine up towards your armpit because there is a little tongue of tissue that goes up there. It's called the axillary tail. So it's a little bit of normal breast tissue. And again, you need to make sure that that's part of your self-check. And also you would then feel if there are any lymph glands in the armpit. If you do feel anything in the armpit, try not to panic. I see a lot of women who have swollen glands for many, many other reasons. Something as simple as a sore throat can actually give you swollen glands in the armpit. And there's quite a lot of women at the moment who've had the Pfizer vaccine who are getting what's called reactive lymph nodes in the armpit. So please, if you do feel anything, make sure that you get it checked because it's probably nothing to worry about. You must also examine behind your nipple. So make sure if you don't do that during the initial assessment that you go back and just press over the nipple area to make sure you feel that. And in terms of the amount of pressure, you can do it lightly to begin with, but you must make sure that you press firmly enough so that you're actually getting to the tissue at the back of the breast on the chest wall. But all of this actually, including looking at yourself and examining, should take less than 5 minutes to do both sides. And one thing I forgot to mention, apologies, is that if you're examining your right breast, you would use your left hand, and if you're examining your left breast, you would use your right hand. So going back to the concern that patients raise, saying, "But I don't know what I'm feeling for." We're not asking you to be a doctor. We're asking you to become familiar with your own breasts and know what's normal for you. Just like you know what your hair color is, you know what your feet look like. You really need to understand your breasts as well. Next slide, please. So we do have an examination leaflet, a self-examination leaflet, which we provide to all women who come to the clinic. And there are a number of websites out there that does have quite helpful information. If you do want to go online, then please do stick to reputable websites. Many of the breast cancer charity websites actually do have links to self-examination. Just be aware that there's a lot of misinformation out there, so just be careful with that. Next slide, please. So what kind of things might you find that actually could be normal? Well, one I've already mentioned is this asymmetry. If it's something that's been long-standing, perhaps it occurred after pregnancy and breastfeeding and your breast changed, and maybe your baby preferred feeding from one side. Sometimes that means that breast always stays a little bit fuller and a bit more swollen. Breast pain is a very common symptom, and I see a lot of women with breast pain. And I can reassure you that breast pain is not a symptom of breast cancer. Interestingly, what alarms women the most is if it's only on one side. If it's both sides, I think women understand that it's probably hormonally related. But if it's just located on one side, it can be very distressing and alarming. So if it's persistent, if you're not sure, please get it checked. If you notice any redness of the breast skin, this may be a slight infection like you would experience anywhere else on your body. You may need some antibiotics for it, but generally speaking, it would not be something related to the inside of the breast. But again, if it's persistent or you're concerned, you need to get it checked. I do see patients with skin lesions, and that's absolutely fine. Interestingly, the skin on the breast is actually just like the skin everywhere else on our body. So sometimes I will see patients to reassure them that there's nothing going on in the breast, and then perhaps a dermatologist will help by prescribing some ointment and the symptoms clear up. Nipple findings, so all of us have different shaped nipples, different sizes, different colors. And again, really it's about a change. If you notice a change, then you need to get it checked. And I'll go into some specific nipple findings that would be a little bit more concerning in a moment. Some lumps are not breast cancer. They can be normal areas of glandular breast tissue, that's swollen milk-producing tissue. But if you do find a new lump, please do make sure you get it checked out. Next slide, please. So let's say that you are worried about breast cancer, understandably. There's lots of information about it at the moment. So what do you need to look out for? What do you need to get checked? Next slide, please. So this is a really fantastic graphic called Know Your Lemons. And this is a pictorial representation of breast cancer that was developed by a PhD student in the UK. Her grandmother developed breast cancer, and she realized that aside from showing her grandmother lots of pictures of breasts, there really wasn't anything else out there. And understandably, her grandmother didn't really want to look at pictures of breasts with breast cancer in them. So this young lady developed this Know Your Lemons graphic, and it's a great thing. You can download it onto your phone. You could print it out as a picture and have it in your house. And if any of your children found it, then it wouldn't be anything too alarming for them. Next slide, please. So in terms of what do we call what are we worried about? The red flag symptoms. Now, all of these are things that we recommend you see a doctor as soon as possible. It does not mean that you have breast cancer. So if you notice a new lump or thickening, either in the breast or the armpit area, if there's a change in shape, size, or feel of the breast, if you have any puckering, dimpling, or redness of the skin, that particularly if it's persistent, inversion, which means pulling inwards of the nipple, or if the nipple appears to change position, so it looks like it's a bit higher, or it's being pulled sideways, and particular type of nipple discharge, which comes on one side only, it comes out of one spot on the nipple, and it has blood in it. Next slide, please. In terms of nipple symptoms, any persistent lumps or bumps, any nipple pain or itchiness, again, that is persistent, changes in the skin texture or color of the nipple or the areola area, if the nipple areola size changes. And again, particularly if you notice that your nipple is being pulled inwards or retracted, that can be a sign that you need to get that checked out. And again, the abnormal nipple discharge that I've mentioned, particularly blood-stained. However, even in that situation, it's very rare to actually have breast cancer. The blood-stained nipple discharge is normally a sign of inflammation. However, please do get it checked out as soon as possible. Next slide, please. So let's say that you've done your check and you haven't noticed any of the symptoms that I've just talked about, but you'd like to be breast aware. When should you start screening? Next slide, please. So in the UAE, breast self-examination is recommended for all women from the age of 20. Between the ages of 30 and 40, some women choose to have what's called a clinical breast exam, where they come to the clinic and I'm able to talk to them about their risk factors and any family history, perform an examination, and potentially organise an ultrasound scan if necessary. We don't use ultrasound routinely as a screening tool. It's very good at looking at a particular thing like a lump or an area of the breast, but it's not actually validated as a screening tool. So if women ask me if they can have ultrasound instead of mammogram, I do explain to them that we look for different things and therefore we do need to do a mammogram and recommend that. So women from the age of 40 are offered bilateral screening mammograms. The exception to that would be for women who are at a higher risk of breast cancer due to their family history, or if that individual has had a personal history of radiotherapy as a teenager, as a child. That's usually for a certain type of blood cancer called lymphoma. We will offer breast ultrasound scans to women with dense breast tissue, and I'll show you some examples of that in a moment. Next slide, please. So breast screening, how do we do it? Well, it starts with you. It starts with you at home doing the breast self-examination. We can then add in the clinical breast examination by a medical professional. Traditionally, that's been done by a gynecologist or a family medicine doctor, but increasingly we are seeing subspecialization. I myself am a general surgeon. However, for the last 8 years, I have specialized in breast, and this is my area of expertise, so I only see patients with breast problems now. In the breast clinic, we have the advantage of being able to offer the clinical examination and also the imaging on the same day if that's convenient for you. Next slide, please. Excuse me. So in terms of screening, we recommend screening from the age of 40 with bilateral mammograms, and we add in the breast ultrasound scan if there's high breast density. This should be performed every 2 years in the UAE. We may recommend starting earlier due to family history, and we may include breast MR scans for high-risk women, and we may increase the frequency to every year in higher-risk women. Next slide, please. So on the screen now, you can see some normal breast screening mammograms. We take 2 pictures of each breast, so 4 pictures in total. This individual has quite dense breast tissue. You can see the relatively white tissue in the center. That's all normal breast tissue. Next slide, please. And this is the breast density that I was talking about. So on the left in picture A, we have very fatty breast tissue. So it's actually quite easy for us to see if there's any change, if there's anything on that mammogram. Whereas the mammogram on the right, which is glandular, that is normal breast tissue, but it's much more difficult to interpret. So for women who have breast density C and D, we would add in bilateral breast ultrasound as part of the screening process. Next slide, please. So just a few slides on family history, because again, this is something that's understandably a great cause of concern. What should I do? Next slide, please. So every country has a different protocol for imaging healthy women with a family history of breast cancer. So what I'm able to do in the clinic is I'm able to take a full family history, not just of breast cancer, but also ovarian cancer, because there is a link between the breast cancer genes with breast and ovarian cancer. And there are some computer algorithms that we can actually put your data into to work out what's your individual risk of developing breast cancer in your lifetime. If you have a pattern of lots of different types of cancers in your family, then I would suggest that you see a genetic specialist, either a doctor, a nurse, or a counsellor, because they will be able to recognise patterns within the family across the different cancer types and give you accurate recommendations based on that. In terms of genetic testing for breast cancer, the test is easy. It's a blood test. However, I always counsel the women about what the consequences of a positive test might be, because that can be quite, it can cause quite a lot of change in that woman's life. So I always ask, what would you do with this information? Who is it for? Would you undergo risk-reducing surgery, etc.? So it's really important that the woman understands what she individually will do with the information from the test results. Fortunately, many women are negative, but we do just have to counsel women about the small chance of being positive. Next slide, please. So we do count only blood relatives, and we count the mother and father side of the family separately. So although you get half your genes from each side, we don't add the risks together. So if you have, for example, an aunt on one side and an aunt on the other side, so it's a maternal aunt, and a paternal aunt, that actually puts you in less risk than if you had, say, two maternal aunts with breast cancer. And there's a list of things here. I won't read it out in full, but these are the certainly the triggers for recommending breast cancer genetic screening. So particularly a particular type of breast cancer, triple negative, if somebody has breast and ovarian, or if you have multiple members of an extended family, they would all be strong indications. Next slide, please. So this is a very good question that unfortunately we don't have an answer to at the moment. Lots of people are doing lots of research to try and understand this, but we do know that there are some risk factors and there are some preventative factors. Next slide, please. So in terms of risk factors, the words in pink are what's called modifiable. So they are things that we do actually have control over. They are things that we can do something about. The risk of breast cancer with HRT is actually very small. I don't advocate for HRT if somebody's asymptomatic. However, if somebody's having quite significant symptoms from the menopause, then I think it is important to have a conversation to understand what the benefit might be for that individual. The contraceptive pill, which is sometimes used to regulate heavy periods, again, there's very little evidence that that actually has an association with breast cancer. We can't control our family history, and unfortunately, none of us can control getting older. But we can look at our physical activity, weight gain, and alcohol intake. Nulliparity means not having any children, and the increased risk is thought to be related to the fact that we have a greater exposure to estrogen in our body if we're not pregnant or breastfeeding. So any of you who've had children and you've been breastfeeding, they are definitely protective. Next slide, please. So independently, regular physical activity, having a normal stable weight and eating a healthy diet are all independent preventive protective factors. So please go for a walk, get your heart rate up, make sure that you're eating a healthy diet full of vegetables, and make sure that your weight is within the normal range. We know that unfortunately obesity is associated, is linked to a lot of different types of cancers. Specifically in breast cancer, we believe it's because fatty tissue actually creates the hormone estrogen. So it's actually generated and produced in the fatty tissue. So particularly after we've been through the menopause, when our estrogen levels fall, actually by having excess weight, you're actually falsely elevating the estrogen level in your body. And it may be that that's where certainly your estrogen sensitive breast cancer is more of a risk for you. There are some drugs which are protective. However, aspirin is still being evaluated, and the chemo prevention medication is normally for women who fall into a high risk group because of family history. So attending for regular mammographic screening is definitely protective. It does not give you breast cancer. Very occasionally, we do find small things that are nothing to worry about, and we need to go through the process of assessing that. But I think the benefit and the balance of finding a cancer at a smaller, earlier stage before even someone like myself, who's got all this experience before I can even feel it, definitely, as I say, reduces the need for treatment, particularly chemotherapy, reduces the amount of surgery that we have to do, and really gets you back into your normal life much more quickly. So please do attend for your regular mammographic screening. Next slide, please. So a few myths around breast cancer. Being hit in the breast, drinking warm water from a plastic bottle, deodorant, stress, mobile phones, and particularly I want to just highlight the one in red at the bottom. So a mammogram or a biopsy does not cause cancer to spread. Next slide, please. All of these are myths, so none of them cause breast cancer. Next slide, please. So please remember that breast cancer is not just a lump. Please get to know your breast. Do your self-examination once a month. That's all you need to do it. You don't need to do it any more than that. Please make sure that you know that the men in your family are also at risk, albeit less than women, but please make sure they are aware. And if you do notice any symptoms or anything you're not sure about, please do get it checked. Next slide, please. So at Mediclinic, we have a number of people in our team. Next slide, please. And we're all waiting to, we're able, myself, we offer male and female doctors, Arabic and English speaking. Next slide, please. And we're able to offer, as I say, full assessment through the clinic with the support of a clinical nurse specialist. Next slide, please. So just going back to the quiz. Next slide, please. Hopefully you've been able to answer all of these. So mammographic screening should be every 2 years. You can do breast self-examination at home. Breast pain is not a symptom. Do not usually have a family history, and men can get breast cancer. Next slide, please. So just a little bit of information. I'm very happy to share this, these websites if you have any further interest. Next slide, please. And I think, so I think that's all I have to say today. I hope that's been helpful, and I look forward to answering any questions that you may have. Thank you very much.
Thank you, doctor. We are now going to take questions. For the participant or for our people on the other end, if you'd like to ask questions, we still can take them by putting them into the chat box. So starting with the first question, women who have undergone hysterectomy are at less risk. I'm not sure if I've said that properly.
Yeah, hysterectomy. Yeah. It's,
Okay.
Yeah. Yeah, that's a really good question. So hysterectomy involves removing the womb, but actually it's the ovaries that are linked to the breast. So if a woman has had a hysterectomy, that wouldn't impact on her breast cancer risk. However, for somebody who's had her ovaries removed, then potentially that would reduce the risk, but really only for women who have a proven genetic mutation. So I would not encourage anyone to have their ovaries removed to reduce their breast cancer risk unless there's a genetic change that's been identified.
Okay. Another question says, can mammogram or breast ultrasound be done when we are pregnant?
Yeah, so very good question. So it is technically possible to do a mammogram. That does involve X-ray, but what we can do if we need to is we can shield the baby. So we put almost like a lead apron over your tummy, depending on what stage of pregnancy you're at. We do try to avoid mammograms if possible. We would only do it if we had some concern. It's very easy to do an ultrasound scan. There's no X-ray involved. The breast tissue, as I said, is it's a little bit more difficult to examine during pregnancy and breastfeeding because it's very swollen, quite bumpy. But absolutely, it's very easy to do an ultrasound scan. Yes.
Okay, thank you, doctor. Another question. I have family history of cancer with my father's side. So the breast cancer history is from the father's side. Since it is in my genes, what is the probability of me having the disease despite trying to live healthy, eating more veg, regular exercise, water? So she's living a healthy lifestyle.
That's fantastic. I think and I think you're doing everything you can to reduce your risk. And I think this sort of links back into the, what is your risk? Because actually the majority of breast cancer, there is no genetic link. And we do sometimes see families where there are a number of women in the family with breast cancer, but actually, if we were to check your genes, then we may not be able to find anything. So although perhaps, let's say your aunt had it, maybe your grandmother had it, it doesn't automatically mean that you're going to get it. However, it is important that you're aware, and if you're not sure, go and have a family history assessment so you can get a better understanding for you individually. But definitely carry on doing all the healthy things you're doing. That's definitely helping.
How many times per year okay, I think the question here, how many times do I have to go and check the doctor and do a breast cancer check? Young women, do they need to test for breast cancer? And I'm assuming here when she says test breast cancer is going to the doctor if they're young.
Yeah. So in terms of the screening, so the mammograms, as I said, are from the age of 40. Between the ages of 30 and 40, some women do come to the clinic to get checked out by a doctor sort of maybe once a year. I don't think you need to go any more frequently than that. I think particularly as women become more familiar with their breasts, then yes, you go if you have a symptom. But we also, it's really important to raise awareness, but not to raise anxiety. You know, we're trying to support women to be aware, but we don't want to create a lot of anxiety. So if you have a symptom, please go and get it checked. Otherwise, you can go and see the doctor if you want to, but it's not something you have to do.
And a very important point, like a doctor, I had someone was speaking to me and they said, oh, I'm waiting for the breast cancer month to go and check my breast. I was like, no, that doesn't work that way. Wait till October. If you have an issue, go immediately and check.
Absolutely, absolutely. So October is a great month because we're all talking about breast cancer, but really, yes, we should be talking about it all year. Please don't wait until October. Make sure if you have a symptom, go and get it checked out now, definitely.
So another question, does the size of the breast affect the possibility of getting breast cancer?
So that's a really good question. And that's a little bit of a myth. So the simple answer is no. There does not seem to be any association. For example, you might think, well, if I've got a larger breast, I've got more tissue, must have a greater risk. It actually doesn't work like that. I think what's interesting for women who have larger breasts is it can be more difficult to examine yourself because there is more tissue, it's a bit deeper. So I think it's even more important to be breast aware and to go and seek a further review. If you're not sure at all, then go and see somebody. But no, having larger breasts does not put you at an increased risk.
Talking about large breasts, there's a lot of women going through the implant, and does that make it difficult to check if there is a cancer, or what is the procedure if you're going to an implant to make sure that?
Yeah. So again, there's no association between breast implants and most types of breast cancer. There is a very rare type of blood cancer. Now it's a tiny proportion of women who have had what seems to be a particular type of breast implant. And that is sort of separate, but in having breast implants does not put you at an increased risk of breast cancer. It can make the mammograms slightly more difficult, but there is a technique where we can displace the implants so that we can fully see the breast tissue. So it's really just about making sure that we get full coverage. And sometimes we may have to take, one or two more views just to make sure that we've fully assessed the patient.
Okay. Another one here, the initial stage. Okay, from the initial stage to the final development of the breast cancer, how much duration does it take to spread the cancer?
So that's a very good question. It's all about what we call tumor biology. So breast cancer is not a single disease. So breast cancer actually has a number of different markers. I mentioned one of them called the HER2 marker, which is a growth factor. There's also the estrogen, which some of the cancer cells feed off, some of them don't. So we know that there are certain factors which make cancers more aggressive. So they are more likely to spread more quickly. But we're still learning. We still don't have a huge understanding of how long cancers have been there before we find them. And because we tend to treat them and try and get rid of them as quickly as possible, it's difficult to say exactly what that spread would be.
Yeah, and I think that's where our webinar and the session and the whole month of October is not to reach to the stage where it's breast. That's why the early detection, that's why the early and the self-examination is very important.
Yeah.
Another question, can clogged milk ducts cause breast cancer?
So no, they can cause a lot of alarm because they can present with a lump, they can present with persistent redness on the skin, and it can be particularly alarming because you'll have a young baby and your breast will be swollen and uncomfortable, and it may make it difficult for you to sleep, and sometimes that's quite exhausting. So sometimes you can have a lot of fear, but actually having a clogged milk duct does not cause breast cancer, but we still need to manage that. We still need to manage the clogged milk duct. So if it's not settling with simple warm compress and massage, sometimes we do need to give you a short course of antibiotics. I try and avoid it as much as possible, but if it's necessary, then that's what we'll do, and then that will give you the reassurance, and we can do an ultrasound scan as well if we need to. So.
Does women with PCOS have more chances to get breast cancer? First, I have to ask, what is the PCOS?
Yeah, so PCOS is polycystic ovarian syndrome. So that's essentially where, for some reason, the hormone causes lots of cysts on the ovaries, and there's no association between PCOS and breast cancer.
Okay, I was taking pregnancy treatment in the last from few years. I'm not sure here. So she was taking pregnancy treatment. I am observing some liquid substance from my nipple if I press my nipple.
Yeah, and that's actually it's a really good point, because I actually see quite a lot of women who have fluid discharge from their nipples, particularly just if they gently press their nipple. And for the majority of women, this is what we call physiological. So particularly if it's coming out of both sides, it's coming out of multiple spots on your nipple, it might be a white or a green color. It's a sort of almost your body is still not quite sure if you've finished breastfeeding, even if it might have been a number of years ago. So the advice is not to squeeze, because if you squeeze, then your body actually thinks that a baby is trying to latch on, and it will actually produce more fluid. If you find it's spontaneous or there's any blood, please come along, get yourself checked. We can just, again, do an ultrasound, check the fluid, make sure there's no infection, just reassure you, make sure there's nothing else going on.
Great. Should I start breast self-examination? Okay, when should I start breast self-examination? How often and at what age?
Yeah, so the recommendation is to start it from the age of 20, and you do it once a month. You don't need to have any mammograms or ultrasound scans in your 20s. As you move into your 30s, you may find that your breasts change a little bit, and you perhaps want to come and have a clinical examination, possibly with an ultrasound scan. And then, as I said, if there's any family history, then we may look at screening earlier, but otherwise it would be mammograms at 40.
Okay. So another question here, I was exposed to radiation when my husband was getting treated for cancer. Should I be worried?
So that's a little difficult to answer without further information, but I think in terms of the radiotherapy treatment that I was referring to for young patients, it's usually a specific treatment with a radiotherapy machine. If you were exposed to radiation, for example, maybe he was having scans, things like that, then no, that wouldn't increase your risk, no.
Okay, what is the effect of the contraceptives on the risk of breast cancer?
Yeah. So there's been a lot of work done on this. There's a number of very large studies. There was one study that I think had 1 million women in it, and we've got a huge amount of data from that. And the oral contraceptive pill does not appear to cause an increased risk of breast cancer.
Another one here is itchiness also a sign or a factor having breast cancer?
So generally speaking, itchiness on the breast skin wouldn't be anything to be concerned about. It's more likely to be something like eczema, particularly if you have dry skin elsewhere on your body. I quite frequently see women who have eczema on the areola area, which is the area next to the nipple. But again, I can see women, reassure them, and then provide some creams or liaise with a dermatologist. However, if it's your nipple that's itchy, then your nipple is part of your breast. Again, it may just be a little bit of dryness, you may need some cream, but it's worth just getting that checked out because that's a slightly unusual symptom.
Okay, I have another here. How long chemotherapy take? How I will know that I'm completely clear from cancer? Which blood test can I do after chemotherapy?
So chemotherapy for breast cancer, we have different regimes and different drugs. So the commonest regime is 6 to 8 treatments every 3 weeks. So it's over about a 6-month period. We do, for some women, offer a slight what's called short course chemotherapy. So they have a treatment every week, and that's usually for 12 weeks or 3 months. In terms of knowing if you're completely clear from the cancer, anybody who's having chemotherapy treatment will be monitored with scans, either ultrasound, MRI, or CT scan, sometimes a PET CT scan. And after chemotherapy, the only blood test that we have is something called a tumor marker. It's called CA15-3. It's not diagnostic, so we tend to look at trends. So we might do it as a baseline after your treatment, and then if it was rising, then we would want to look to see if there's something going on, but they're not very specific. So that means they can go up for other reasons. So we don't treat purely based on blood tests.
And how regularly you have to do it? So you've done the test, the doctor said, fine, you finished your chemotherapy, you're cleared. Do I have to do it on a regular basis? And do we continue doing the breast check self-examination?
Yeah. So we would recommend doing annual mammograms after a diagnosis and treatment for breast cancer. Usually in the immediate time after treatment, you'll be seen 3 months, and then at 6 months, and then at 12 months. You might be seen by different clinicians depending on which treatment you've had. And as I say, we would do mammograms at 12 months from your diagnosis, and MRI and ultrasound if required, CT scans if required, and again, blood tests, but only if required, yeah.
Okay. Are the symptoms of the breast cancer in men same as women?
Yeah, so actually they're very similar. The commonest for a man is to have a lump behind the nipple, or possibly a lump under the arm. Sometimes they can get a little bit of fluid leaking, so a little bit of nipple discharge, or they could get a little bit of skin changes. So broadly speaking, yes, they are the same.
Okay, I'm going to take the last 2 questions. There is a huge amount of questions arriving, but unfortunately, due to the time, I'll need to cut it. So this is the last 2. Does using products with PrEPness increase risk?
Yeah. Parabens. So as I sort of mentioned, 90% of women who have breast cancer do not have a genetic link. So that means there's something environmental that is causing this explosion in breast cancer across the world. And we don't know what it is. Could it be parabens? Could it be another chemical? Could it be something to do with our diet? We just don't know. So I think really what we're all trying to do at the moment is we're trying to be healthy. We're trying to eat fresh fruit and vegetables, try and eat meat that's as healthy and fresh as possible. So I can't answer directly about parabens, but I think avoiding any unnecessary chemicals is a good thing.
Okay, last question. What is the difference between chemotherapy and radiotherapy?
Yeah, really good question. So often people get confused between this. So chemotherapy is a drug treatment. It treats the whole body, and it's quite toxic. So you do get side effects like losing your hair, losing your eyebrows. However, it does grow back, and you can get your eyebrows tattooed before treatment if you want to. Radiotherapy is a local treatment. So we have a big machine, and it essentially fires the radiation therapy into your breast. You don't see it, you don't feel it. It causes a little bit of swelling and redness of the skin. You don't lose your hair. You feel a bit tired afterwards, but essentially it's focused just on the area where we deliver the radiation, and it attacks unstable cells and kills off any cells that might be thinking of turning into cancer.
Thank you, doctor, for the interesting subject and answering the question. I do apologize for the ladies that I couldn't ask their question, but we're going to the best bit, and everyone's been waiting for, which is the draw on the 500 Amazon vouchers. We're going to have 3 winners. So our control room, whenever you're ready, can we start? And ladies, once the name is being announced, there will be an email sent, will be email sent to you with the gift. It's the email that you have registered at the beginning of this session. Control room, can we start, please? Now, who's going to be our first winner? Okay, I'm going to apologize if I don't get the name correctly, but this is the Sodada Esperara. I do apologize, but congratulations for the first winner. You've just won a 500 Amazon voucher. Can we go to the second one? Layla Aludwan. Layla Aludwan is our second winner. Congratulations. Mariam Khalid, our last winner, thank you so much and welcome all to this presentation. It was very nice to have you here. All the winners, you're going to receive an email. Everyone there, please stay safe. Please make sure that you have your self-examination in a regular basis. Thank you again. There will be a small survey, short one. We would appreciate it if you could answer it. That will help us to improve for future webinars. Thank you again. This was Rawia with you.